Pyometra is a serious infection of the uterus in female pets. It is a life-threatening condition that requires immediate veterinary attention. Pyometra occurs when the uterus fills with pus, posing a significant risk to your pet's health and well-being. This condition is most common in unspayed dogs and cats. It typically arises a few weeks after a heat cycle. Hormonal changes during the heat cycle create an environment in the uterus conducive to bacterial growth. Pyometra is a very serious condition. It can be fatal if left untreated. Early recognition and prompt veterinary care are crucial for a successful outcome. If you suspect your pet may have pyometra, contact your veterinarian immediately. Recognizing the signs of pyometra is crucial for early intervention. Symptoms vary depending on whether the cervix is open, allowing discharge, or closed, trapping pus inside. Common signs of open pyometra include pus-filled discharge from the vulva, often foul-smelling. Loss of appetite, lethargy, increased thirst, and frequent urination are also common symptoms. Closed pyometra, where the cervix is sealed, is more difficult to detect. Symptoms are less obvious and may include lethargy, loss of appetite, vomiting, diarrhea, abdominal swelling, and a high fever. If you notice any of these symptoms in your pet, do not delay seeking veterinary attention. Early detection is key to successful treatment. There are two main types of pyometra, open and closed. The type of pyometra determines the severity of the condition and the appropriate treatment approach. Open pyometra occurs when the cervix remains open, allowing pus to drain from the uterus. While less immediately life-threatening than closed pyometra, it still requires prompt veterinary care. Closed pyometra, on the other hand, occurs when the cervix is closed, trapping pus within the uterus. This creates a highly dangerous situation as the infection intensifies and can lead to sepsis. Both types of pyometra are serious and require immediate veterinary attention. Your veterinarian can determine the type of pyometra and recommend the best course of treatment. Section 4. Why did this happen? Understanding the causes. Pyometra is caused by a bacterial infection in the uterus. While several bacteria can cause pyometra, E. coli is the most common culprit. The infection typically occurs after a heat cycle when hormonal changes create an ideal environment for bacterial growth. During heat, the lining of the uterus thickens to prepare for pregnancy. If pregnancy doesn't occur, the thickened lining becomes susceptible to infection. The use of certain hormones, such as progesterone, to prevent pregnancy or manage heat cycles, can also increase the risk of pyometra. These hormones can disrupt the natural balance within the reproductive system, making the uterus more vulnerable to infection. Understanding the causes of pyometra is essential for prevention. Spaying your pet is the most effective way to eliminate the risk of this life-threatening condition. Section 5. Risk factors. Who is more likely to develop pyometra? While any unspayed female dog or cat can develop pyometra, certain factors increase the risk. Understanding these risk factors can help pet owners take proactive steps to protect their furry companions. Age is a significant risk factor, with older pets being more susceptible to pyometra. The risk increases with each heat cycle, especially in pets who have not had a litter. Certain breeds, such as Bernese mountain dogs, Rottweilers, and Golden Retrievers, have a higher incidence of pyometra. This may be due to genetic predisposition or breed-specific hormonal factors. The use of certain medications, particularly hormone-based medications for preventing pregnancy or managing heat cycles, can significantly increase the risk of pyometra. These medications disrupt the natural hormonal balance, making the uterus more susceptible to infection. By being aware of these risk factors, pet owners can make informed decisions about spaying and discuss any concerns with their veterinarian. Section 6. Treatment options. Saving your pet's life. Early diagnosis and treatment are crucial for saving a pet's life from pyometra. The most effective treatment is surgical removal of the infected uterus and ovaries, known as an ovariohysterectomy. In some cases, if the pet is stable and the infection is caught early, medical management with antibiotics and prostaglandins, hormones that help the uterus contract and expel pus, may be attempted. However, this approach is less successful and carries a higher risk of recurrence. Supportive care, including intravenous fluids, pain medication, and antibiotics, is essential regardless of the treatment approach. This helps stabilize the pet, address dehydration, and combat the infection. The prognosis for pets with Pyometra is good, with prompt and appropriate treatment. However, delaying treatment can have devastating consequences, including sepsis and death. Section 7. Prevention is key, safeguarding your beloved companion. Preventing Pyometra is the best way to protect your furry friend from this life-threatening condition. Spaying your pet is the most effective preventive measure, eliminating the risk of Pyometra entirely. Spaying not only prevents Pyometra but also eliminates the risk of uterine infections, tumors, and cancers of the reproductive system. It also prevents unwanted pregnancies and eliminates the inconvenience and mess associated with heat cycles. If you choose not to spay your pet, be vigilant about monitoring for any signs of Pyometra, especially after heat cycles. Regular veterinary checkups are also essential for early detection and management of any potential health issues. By being proactive and well-informed, pet owners can ensure their furry companions live long, healthy, and happy lives, free from the threat of Pyometra.